I will call the meeting of the Blackhawk County Board of Supervisors to order. Mr. Veeder, roll call vote, please.
Leyland. Here. Little.
Here.
Schwartz.
Here.
White.
Here.
Trelka.
Here. Now let's have a moment of silence to reflect on our actions. Please join me for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll entertain a motion to receive the agenda as proposed or amended.
So moved.
Second.
All those in favor say aye.
Aye.
Opposed? It is approved. We are in the public comments section now in discussion with our council. I'm going to ask members of the public to comment now on any matter on the agenda. You're limited to 3 minutes for the sake of time and according to our rules. And when you speak, I'd like to ask you to provide your name and your address. So do we have anybody in the boardroom right now who would like to speak? Then I'll move on to those on the phone or on Zoom. Okay, yes, sir. Please approach the podium.
Can I remove my mask? Is that protocol, or should I keep it on right here?
Once Kim gets away from it.
We're socially distanced, aren't
Yep,
we?
go ahead,
Great.
sir.
Okay, thank you. Thank you, Supervisor Trelka, and thank you to all of you who have chosen this form of public service to serve the citizens of Blackhawk County. I appreciate it. My name is Joe Gorton. I've been a citizen of Blackhawk County for 22 years. I live at 510 Wilshire Avenue in Waterloo, and I believe this is my first time, I know this is my first time to ever appear before the Board of Supervisors. So out of 22 years, maybe I'll come back in another 22 years if I'm still kicking. All right. So the reason why I'm here today is over the concern that I and a great many people in the county have about proposed cuts to the Department of Health. Now, normally, when cuts are made to a public agency, it's because there's some kind of fiscal crisis or fiscal issue, some kind of problem. But when I look at a budget book for the county, I note that, first of all, this county, and I'm sure the finance director might agree with this, is in pretty good fiscal shape. You're doing pretty well as far as I can tell. And the Department of Health in particular is doing quite well in its finances. Now, I note that our revenue for the county grew 4.3% between fiscal 19 and fiscal 20. That's countywide, all right? Now, it's interesting that in the with the Department of Health, expenditures, which we all kind of as taxpayers like to see, right? Expenditures declined 18%, 1.7 million in the Department of Health. That's just one department, right? Right? So they're doing their part to be as efficient as possible, to be efficient stewards of taxpayer dollars while accomplishing their mission for public health. And I would also note that from fiscal 11 to fiscal 20, according to your budget book, that the county had 25 cuts in full-time positions, 25. Of those, 21 came from the Department of Health. Okay, now this had to do with the privatization of some of those services and things, I believe, but that's 84%. So no one can rationally argue that the Department of Health is not doing its part to help secure the financial well-being of this county. So it just makes us wonder why at this moment in the middle of a pandemic, right, and we are, make no mistake about it, we are in the middle of this pandemic. Anybody who believes we're on the downside of this isn't paying attention. We're probably going to have a seasonality effect, another surge in the spring. In the early spring, you'll recall that's when the surge, the first time this began, and what epidemiologists are tending to agree on is a surge when the temperatures get between 20 and 50 degrees, as they did in October and November, okay? So we're nowhere near the end of this. We're still in a public health crisis. Now, initially, your motion, I don't know what you're going to do today, but initially your motion was to cut an epidemiologist, which seemed really foolhardy and dangerous to me and the people I
Mr. Gorton, and I'm going to ask you to wrap it up because we're getting near 3 minutes here, and we want to be respectful of other people's time.
So here's what I'll say. This doesn't seem to be about finances to me, okay? This budget cut would amount to about one-tenth of 1% of county expenditures. Think about it, 1/10 of 1%. It's negligible. It's almost nothing. So it must be about something else. What could it be? It has to be politics, okay? I don't see any other way around it. I've been doing politics for a long time, and I fear it's about some pretty petty politics. So here's what I'm going to say. The politics of COVID-19 do not favor people who do not take a cautious approach to protecting the public, and the last election just bore that out. So I would urge you to leave the Department of Health sound, leave it unharmed by any kind of budget cuts. All right? Thank you.
Thank you. Do we have anybody else in the boardroom that would like to publicly comment? Who on Zoom would like to go next? Who on Zoom would like to provide a public comment? Yes, ma'am.
Neva?
Lisa Munoz.
Yes, I will go. Thank you. My name is Lisa Munoz, and I live at 1169 Rainbow Drive in Waterloo. And I would just like to echo Joe's points, but I would like to make two additional ones. The first is that unfortunately, Black Hawk County has been known for systematic racial disparities. And one of the county organizations that I think does a really good job of addressing some of those is the Public Health Department. Public health is something that looks at individuals' well-being within the county on a holistic level. And a position like an epidemiologist is one that can help track some of those issues that impact people disparately in our community. And so I would just like to reiterate that point. Secondly, I'm curious if the Board of Supervisors has looked at any return on investment data. For example, what are the potential social, economic consequences of not funding this type of position? So if we're talking about less than $100,000 or roughly $100,000 a year, what are the social and economic consequences that might spur or that might fall down the line for not funding a position like that? And by that, I mean everything from mental, physical health, the disparate spread of COVID, as well as other communicable illnesses or diseases, and those kinds of things. So I would just ask the Board of Supervisors to consider the significance of this position beyond the initial cost and think about the long-term ramifications of defunding the Public Health Department. Thank you.
Thank you. Ms. Reyes.
Yes, thank you. My name is Nilvia Reyes Rodriguez. I live at 1111 Patton Avenue in Waterloo, Iowa. I am just here to comment. I was here a few months ago during a meeting where the board was discussing a mask mandate. And at that time, I heard leadership at the health department speak. And since that time, I continue to see the same frustration. Like the board of supervisors is tying their hands as far as what they can do for our local community. We know that leadership from the federal level, state level, the pandemic is a difficult thing to navigate, but we are at an opportune time and an opportune situation and position here locally that we can do something about it to help our local community right here that has already suffered, I think, enough through this pandemic. And I continue to see that the leadership at the health department is just, they are doing the most that they can with the resources that they have. They need to continue to be able to do more. This is with the second epidemiologist within their budget. And I think that the Board of Supervisors is responsible for allowing them to do the most that they can do. So again, I will reiterate what I said at the last meeting. Like I said a few months ago, and that one was about the mask mandate. The public, everyone here on this Zoom call, everyone there in person, we are watching. We are taking note of what you are doing. accountable at elections. And I think that this is a moment where you can show that you do care enough about our community to continue to do the right thing. And that's all I'll say at this moment. Thank you.
Thank you. Ms. Creighton Smith.
Yes, hi, good morning, everyone. Yes, my name is Belinda Creighton Smith. I reside at 416 Oliver Street, Waterloo, Iowa. And I'm here this morning also to express my concerns for the budget cuts overall to the Black Hawk County Health Department, a department that serves all of the people. And when we consider the rate of poverty in our county, we would consider the rate of the number of Black and Indigenous people of color, we have an obligation to serve all of the community. And by cutting the health department, not only of its epidemiologists, which is critical at a time like this, when we're tracking a pandemic that disproportionately impacts people of color, but all who have fewer opportunities and access to healthcare providers and preventive services and those kinds of things. We have to really, really be considerate. We have to, I'm sorry, someone's talking at the same time. We have to really be conscientious about the cuts that we are making. So,
the others too.
Kim, do you have the ability, oh, thank you. Thank you for muting yourself. I'm sorry, Ms. Creighton Smith.
Thank you.
Go on.
Thank you. Okay. And so I am, the other concern that I have is that when we elect our county officials, we want them to represent our interests, all the interests of the entire community. And our interests right now are not being represented. And our people are at risk of serving of a disservice and being impacted drastically. And so we cannot afford to have this happen. And so I'm asking again that you would reconsider cutting not only the epidemiologists, but any more funding to the Black Hawk County Health Department that is there to not only provide the data that we need, but to minister to or to provide services to the least of these. And that's the least we can do, is to provide service to the least of these. Thank you.
Thank you. Who else would like to comment? Mr. Hall?
All right. Good morning. I wanted just to speak up. This argument being made that Dr. Nafisa and the department could simply, that what the board is doing is approving a dollar amount, and the department can use those dollars however it sees fit. But what that fails to realize is that it's taking dollars that are already maxed out. No one's arguing that the health department is just flush with cash. So what we're saying is that you want to shift priorities from one space to another space in order to protect what ultimately comes back as a very minimal investment from each individual citizen of the county. And so I really want to make sure that the five of you keep in mind that we should not be in a position where we're asking the health department to rob Peter in order to pay Paul. We have the ability to make the investments in public health that, in all honesty, maybe haven't been made year after year after year as they should have been, which is evident by the fact that we have incredibly high, or frankly, incredibly low ratings when it comes to transmittable diseases in this county. To suggest that thing in order to potentially pay for this other position that the county elected officials have deemed unnecessary by their comments really sort of slaps in the face of common sense here. Epidemiologist is not COVID. It is about transmittable diseases. And our county has to make that investment. And so I just wanted to make that really quick comment. Thanks for the time.
Thank you. Miss Butchen?
Hi, it's Butchen, but thank you. Hi, I'm going to speak from the baby boomer aspect, as many of us in this county are. First of all, going back to the mask mandate that Lisa mentioned before, I'm very disappointed that city councils in Waterloo and Cedar Falls have approved an extended mask mandate, but for some reason you have not. And yes, I know not everybody's going to follow it, but my gosh, with the pandemic right now, it's like seatbelts. Hello, just please pass that and go with everybody else. And for the second thing, again, being a baby boomer with underlying conditions, as many of us have. I have had pneumonia. I now have a good friend who has died of COVID because she's had pneumonia in the past. I also have had pneumonia. So many people in our range have heart issues or diabetes or something, no matter what race we are. Those people need to be protected. So I agree with Tavis. It is not just because of the COVID right now, but many other things that are around in our community. And we need the health department to be fully funded. So I would highly encourage you to not pass this resolution today and really think about all of us, from babies to boomers. Thank you.
Thank you. Ms. Nash? Mr. Stevenson?
Pastor Mary sent in to chat that she'd like to speak.
Pastor Mary?
Yes, good morning, Board. I come before you today, first of all, to let you know that it is unanimous from our board. We are still very supportive of the budget that we have submitted. We think that it is the best that we actually could do, honestly, to be able to not only provide the 10 essential services that are mandated by law that we have to do, as well as being able to make some kind of an impact in this pandemic. Just amazed at the rationale. When we talk about economics, I want to remind the board again that from FY16 to FY20, we have returned over $2 million in taxes back to the county. So if it is, and that's because that we do an extremely good job, and I have to take my hat off to Dr. Ibonye and the department. They do an extremely good job of getting grants to offset tax asking. And because of that, so it cannot be because of a financial issue, because we have returned back, like I said, over $2 million from FY16 to FY20. So I'm struggling, we are struggling as a board to see what the rationale could be. We run an exceptional department. In fact, I think the issue came up about the fact that we were taking money from salaries for a car. We looked into that. That is not true. The car cost $22,727. All but $1,900 was paid for by a grant that we were successful in getting. And when you look at $1,973 coming out and match that against $2 million, to me, it's kind of a no-brainer. My concern is that, first of all, we don't know as much as we ought to know, or should, or could know maybe, about COVID. And now we have the various strains. As far as I know, in Minnesota, which is our neighbor to the north, and Wisconsin, which is our neighbor to the east. That's a little bit too close for comfort. And so we not only have to be prepared to deal with what we are dealing with now, we're not even sure what may be coming down the pipe. And so we stand by our budget. We think it's a very good budget. We think that we will be able to at least serve the entire county as best we can. Nobody really knows what's going to happen in the future, whether all the spikes are going to come. But we know that we do have the vaccines, and so we are hoping that there will be some relief there. But I'm saying all of this to say that we more than ever now, today, right now, this moment, believe that we have submitted a good budget and would really be very disappointed if there were any cuts to it. Now, I will say that according to Iowa law, as you know, you have the right to do the funding. But also according to Iowa law, as you know, when it comes to actually operating and cutting positions, that is something that comes within the purview of the Board of Health, of the Department of Health. That was an exception that was made intentionally by the Iowa legislature. And so we feel that we have looked at all of our operating expenses. We've looked at our mission. We've looked under the code as well as our moral obligation to this county. And we feel that this budget that we are submitting is the absolute best that we could submit under the circumstances. And so I want the board to know that we stand by this budget. Thank you.
Thank you. And Ms. Sack, Ms. Van de Venter, and Ms. Zeman, we'll get to you. The person who has identified themselves as John Q. Public, your opportunity is to speak now, but we ask that you provide your name and address, please.
My name is Joe, 108 DeSoto Avenue, Waterloo.
What was your name?
Joe.
Go ahead, please.
Okay, so I took the liberty of doing some investigating, and I called health departments from surrounding counties and counties that are our size, and only one had 3 epidemiologists, and 2 of them were in management positions, which is a similar situation to what Blackhawk County has. They have 1 epidemiologist and 1 that has the training but is in a management position right now. So I don't understand the need for a 3rd position. And looking at even bigger counties like Polk, they didn't have an epidemiologist on staff until COVID came, when they hired one from a temp agency. It's not a full-time gig. It's until COVID's over. I don't understand the salary for an epidemiologist, considering that the way I understood it, they're supposed to study the patterns of how it spread and what happened, and they don't really know anything until after the fact. So what do we need a 3rd person to do that job? I know that the health department, I can't remember the name of the guy that talked first, but he said they had reduced their staff. And when I talked to HR, they said they had 100 employees in 2016, 87 in 2017, and then it got reduced down to about 45 for the last 3 years. So I wonder if they made a mistake when they were going through their changes, and they don't have enough employees now to handle what they needed to do as far as contact tracing and things of that nature. And now they're asking for more money for more positions. I guess that's all I have.
Thank you. Ms. Sack. Renetta Sack.
Unmute yourself.
All right, we'll try to come back to her. Miss Van de Venter.
Okay. Here, can you hear me now?
Yep.
Yes, Miss. Go.
Okay, thank you so much. Sorry for the delay. I'm very concerned about this issue. The underlying responsibility of a health department in a county is to safeguard all of the residents' health. And certainly now, in this moment of our pandemic, we certainly should have all tools in place to help the health department do that. We should have had a mask mandate in spring. It certainly would have helped. And now we should not cut any funding that makes the work for the health department more difficult. The health department is supposed to do research and then assure safeguarded measures for the whole county. We have a hugely diverse population. It ranges from very poor people to wealthy people, and we have lots and lots of different cultures living in this community. Lots of people are handicapped because of language barriers and also insecure feelings. So we need to do our part to make the health department do its work, and the health department is here to help us all together have good health. It will be way more costly to have more spread of this disease than to save from it. So thank you for listening.
Thank you. Miss Van de Venter. D. Van de Venter.
Dee is no longer here. She had to go to another meeting. She sent her response by in the chat box. She strongly approves of the renegotiating the position at the Blackhawk County Health Department.
Thank you. Miss Zeman.
Hi, Catherine Zeman. I'm at 1605 Cherry Lane in Cedar Falls. And I want to address real quickly the comments by the previous caller, Joe, from Joe John Q. Public. And I just want to point out that taking a look at a budget that was based on the way health departments were ran 10, 15 years ago does not give you an understanding of how they have to be ran today. Requirements change. The department has had to seek accreditation. The positions that were eliminated were in primary or direct healthcare services via nurses to schools. No other health department in the state is delivering those kinds of services now. Health departments are to deliver preventive services, and Dr. Igbonye has done an exemplary job of restructuring the department so that it is positioned for accreditation, further grant efforts at the federal level to achieve more funding, and a department that looks like what it should look like today. That doesn't mean things were done improperly in the past. It just means that times change. So I wanted to address that comment because it was very uninformed of the terrain. Yes, you look at something at this higher level where you're just calling around and asking questions, and it would of course raise questions, but what was done was appropriately done as certain services that should have been delivered by the primary healthcare sector and is all across. Doing that would have put this county in a situation where they could have been, you know, in a liable situation if something had gone wrong at one of those schools. So let's just be clear about that so the public really understands that, because I am a member of the Board of Health. And what I also wanted to say is I wanted to thank the Board of Supervisors for their work. And I know they got into this work because they are civic-minded people and they care about the community. And I want to appeal to that kind of thought process right now. I'm appealing to you in that regard because we now face a very serious issue with COVID. We are in the worst part of our fight, as numerous other people had mentioned, and at the same time need to deliver services to very different demographics within the county for both chronic disease and this COVID fight. This is the wrong time to defund the health department. Dr. Igbonye has very carefully considered how we can do both. How can we deliver the equity and chronic disease care and prevention that's needed along with the fight on COVID? Right now, if we don't get the vaccinations out to people and start shutting this community spread of COVID down, it gives it every opportunity to continue to mutate and to develop new genetic sequences that will elude our vaccinations and continue to be more infectious. And literally, it was announced last night by the Department of Public Health in Iowa in general that the Kent variant from England is in Bremer County. They detected that in Bremer County. So it is here. And if they're, having watched them over the several years I have served on the Board of Health, who will help you shut this down, it's the people at Blackhawk County Health Department. So I ask you and appeal to your sense of the possible. Can we do chronic disease and shut this pandemic down at the same time? Yes. Do we have to spend a tiny fraction more to do it? Yes. And I just hope you can meld that idea of vision with the common sense approach that many of you also show. And I hope you'll take just a pause and reconsider your decisions on this. And I thank you for your time.
Thank you. Is there anybody else that would like to comment?
Quentin Hart.
Mr. Hart, Mayor Hart.
Morning, everyone. Just want to say thank you first and foremost for giving me the opportunity to speak. Quentin Hart, Mayor, 745 Boston Avenue is my home address. And I just want to say, you never know what you need until you actually need it, right? And over the last 8-9 months, this community, this county has faced unparalleled challenges. We have seen COVID-19 rip through our community. But in 2018, our county, cities, Waterloo and Cedar Falls, were called the worst places for African Americans to live. And one section of that portion that seems to be the unforgotten portion was regards to overall public health. We've seen over the last couple years since Dr. Nafisa has been here, and this isn't just because I know her, but this is because of the work that I've seen taking place in this community. The emphasis for inclusive public health has never been as good as it has been right now. And I know I sit in the same seat that some of you are sitting in right now. You have to make tough decisions about a budget. You can see where you can cut, and Supervisor and I have been in the trenches with regards to making some of those cuts. But I would just say, from my perspective, this is the wrong time to make those sorts of cuts with regards. We all have friends and family members that are sitting in hospitals right now that are fighting for our lives. We know that it took the outstanding leadership of our health department to even to this particular. Also know that there's increases. I've taken a look at the numbers, and I saw about a meeting or two ago where it's medical supplies, also medical supplies and utilities that are the major increases that we're seeing. And I know dollars have shifted from maybe salaries to this and moved around, but I'm just asking you, with regards to those two areas, COVID and that 24/7 report, I'm just asking that you can reconsider any impacts to the budget right now. We're trying on our end to deal with some of the things from community policing relations and all those things mentioned in the 24/7 report, but public health, another area that was vitally mentioned. And I think you have taken amazing steps to be that inclusive department during the community needs assessment and all of those things. But I'm just asking if you can revisit that and take a look at the resolution a little bit further down and see if you can give some brevity and support to not just that, but also increasing the funding to get the necessary things our community needs. STD, some of the highest rates. Asthma rates in certain parts of the community, some of the highest rates. And I'm not saying that this is because it's doom and gloom, but without the support of a public health department that is effective and has the resources, it's going to continue to be a challenge. So I'm asking that you reevaluate that and please look at that. The county has been a great partner, and we need to be taking a look at how this has an overall impact over the inclusivity of public health to all parts of our communities. Thank you.
Thank you, Mayor Hart. Are there any others that would like to?
He's got his hand up.
Who does?
Kingsley Botchway?
Ah, yes, sir. Mr. Kingsley, go ahead, sir.
Hello, can you hear me?
Yes, we can hear you.
Thank you. My name is Kingsley Botchway. I'm the Chief Officer of Human Resources and Equity for the Waterloo Community Schools. Again, I appreciate the Board of Supervisors' time and opportunity to speak before you today. I apologize. I'm out of breath and running around because we're in meetings all day, and I'm sure that you're impacted as well, just with all the work that the Public Health Department is doing and obviously what it takes to run a county, let alone a school district. However, to that extent, I am a little concerned that this vote, the conversations to reduce the position in public health have been absent the school district's perspective or position. We have been drowning in the amount of work that we have put forward in relation to COVID without the help of Dr. Nafisa Abonye and the Public Health Department. We may not have been able to open schools. And I know that seems a little bit dramatic from that standpoint, but I don't think well, I shouldn't say that, I apologize. I hope that the Board of Supervisors has an understanding of the major institutions within its borders to at least reach out, to have at least some conversation prior to making a vote that would potentially have drastic implications for us continuing to fight COVID in our schools. I think that, I don't want to speak for Dr. Abonye or any of her staff, but they have done a tremendous job. They work weekends. They work at night. I know that I've called a number of different times to the emergency hotline to get information from them in regards to how we respond to our staff to ensure that we have teachers that are effective in their craft before students from that perspective. I think, again, my concern is COVID is not done. And I think that any thought or any inkling that it is dangerous. Having this additional individual on staff, whoever it may be, will greatly help us from a school district standpoint, will greatly help us from a staff standpoint and a student standpoint, ensure that our students are not only safe in the meantime, but also I think my concern is that COVID-19 is not going to be gone for the next year, 2 years, and the effects of it. We need highly trained professionals, individuals within our public health department to be able to provide us with the information on an ongoing basis in relation to COVID's impact, and specifically their partnership with Waterloo Schools and the impact it's had in our system. You may hear some upsetness in my voice, and that's only because I frankly don't understand. And I'm clueless because, I've been running around for the last year trying to figure out how do we ensure that our schools stay open and remain open. And this vote has drastic implications on that. And to not even be a part of the conversation in regards to reducing a position that would matter greatly to the Waterloo schools is tough. Being a former city council member myself, I understand the position that you are in, and there are many times where you have to make very tough decisions in relation to budgets, in relation to other things that, at times you would be able to give the public all the information, but this one is staff to hear. This is tough for, obviously, from an administration perspective to hear. So I urge you again, in all the work that you do, thank you. I urge you again to just please reconsider this vote, and please fund the public health department for what is necessary, not just in the here and now, but in the future as well.
Thank you.
Andrea Geary.
Andrea, what is the last name, Kim?
Geary. There
Yes, ma'am, go ahead.
Good morning. Thank you for the opportunity to speak. I'm at 1816 Tremont Street in Cedar Falls. So first, I'd just like to take a moment and really express some gratitude for Dr. Bonnier and the rest of the Blackhawk County Health Department. I think there's no doubt they've proven an exceptional health department to be guiding us through this hopefully once in a lifetime pandemic. I think everyone else who's spoken before me has done a pretty good job of highlighting what can only be seen as a rather irrational move, that is to reduce funding from the Blackhawk County Health Department during the middle of a pandemic. So I'm going to take a minute to just focus on some other points. And I'm going to pull, this is all data that I pulled from the 2020 Community Health Assessment. I'm sure many of you are familiar with the realities of our county, but just taking a minute to kind of remind everyone, Blackhawk County is rated currently the 61st county out of 99 in the state of Iowa for health outcomes, according to the Robert Wood Johnson Foundation, and that's a slip from the previous year, so we've gone down. Additionally, we have an increasing population that falls below the poverty level year after year, and a higher percentage of individuals than the state and national average in Blackhawk County. More children in Blackhawk County live below the poverty level than the state average, and there was a documented higher rate of child abuse and neglect in Blackhawk County than the state average. A higher percentage of children were uninsured in Blackhawk County than the state average. The total households using food stamps in Blackhawk County has been increasing. Oops, one moment. Okay, sorry, technical difficulties. Suicide rates for adults are higher in Blackhawk County than the state average. Compared to state levels, Blackhawk County has a higher incidence rate for female breast cancer at all age levels. The asthma hospitalization rate for and emergency department visits for children under the age of 5 is much higher than the Iowa average. And depending on the racial group identified, 30 to 50% of the population in Blackhawk County is obese. Lastly, and this is alarming, some of this stuff, of course, Mayor Hart mentioned, but Blackhawk County has been consistently ranked as one of the highest counties in the nation, for overall sexually transmitted infection rates. And these rates are much higher than the state average for the most common STIs, chlamydia and gonorrhea. So given all of the other facts my very capable speakers today have laid out, and the stats I'm reminding you of pulled from our very own community health assessment, I feel there's no way in any good conscience we could reduce funding from the county health department's budget. In fact, given the very capable leadership of Dr. Bonnier and the proven positive impact they have had on our county, if anything, I would be in favor of funneling more resources their way. And that's all. Thank you.
Thank you. Who else would like to speak? Kim is checking messages.
And then we have some chats on the side that I want to make sure we look at as well.
Do what?
There's some things in the chat on the side of people who weren't able to connect.
And we can preserve those chats?
Yeah, I'm
Very
recording
good.
the
We'll-
whole thing, so, but I think this woman especially wanted to make sure that you had, I mean, there's a couple that you should probably read through.
And we will ensure that we preserve those for review after the meeting as well. And we're just reading some of these messages, and as I said, we can preserve them for the future. It doesn't appear we have anybody who is going to publicly comment. So we will move on to agenda item number 3, Years of Service Award.
Okay, well, there's one more chat that you might want to take a quick peek at, or a couple, I guess. So I guess this BLM one. There's another,
She already commented, that's
okay.
somebody that's commented before.
But yes, the chats will be, preserved with.
Thank you.
Email that to the board when they're done, okay?
Thank you.
Mr. Veeder, Years of Service Award, please.
Okay, there are several years of service awards today. For 5 years of service from the election office, Glenn Sears, one of our machine techs. Also with 5 years of service, Michael Hudson from the attorney's office. And for 20 years of service from the sheriff's office, Andrew Snyder. With 25 years of service from Consolidated Communications, both Cynthia Bamford and Charles Hosier. And with 30 years of service from the sheriff's office, Craig Vela. And with 35 years of service, also from the sheriff's office, Lance Tysinger.
35 years, all of them, it's impressive. I've never held a job for 35 years. Thank you, Mr. Veeder. The department heads are going to take those certificates and hand them off to the employees because it doesn't appear any of the employees are present.
I guess there isn't a paper for them. That's right. You're a department head? This is, I think that's all. Oh, I'm sorry.
Item number,
You got it right.
item number 4, claims and payments.
All right, thank you. This week's expenditures total $263,772.88. The larger departments: jail commissary $43,961, secondary roads $12,928, CJIS $64,150, maintenance maintenance $31,168, sheriff department $14,494, and finally IT department $26,901. Everything looked normal.
Okay, thank you, Mr. Perry. So this is a resolution that the Board of Supervisors approve expenditures and that the county auditor be authorized and directed to issue checks against the various settlement of such claims as allowed.
So moved. Second?
Second.
Mr. Veeder, roll call vote, please.
Leyland,
Yes.
Little,
Yes.
Schwartz,
Yes.
White,
Yes.
Velka.
Yes. Item number 5, project updates from department heads and elected officials. Kathy, good morning.
Good morning, Board. Kathy Nicholas, County Engineer. I wanted to give you a couple updates this morning. The Cedar River Bridge Replacement Project is still moving along. If you've been out there lately, PCI has now removed all the material from the old roadbed on the east side of the bridge. Back on the west side of the bridge, that parking lot has been graded. I've told you about that. They've graded the trail out that goes underneath the bridge that allows access to that south side of the bridge. They probably won't place any rock until the spring on the parking lot in the trail area, but they are working as weather is permitting. And then this will be my first update of many on the Grundy Road project. Mid-American has started work out there. Their job, of course, is to relocate power lines. They are moving those back into the newly acquired right-of-way, just pushing them back 15 feet or so, I believe. They are currently working south of the Zion Lutheran Church out there. They do anticipate work going for several months, I believe. We are not charging any working days at this time because that is allowed by the contract to give them free winter work. So PCI is not being charged any time at this point. And also I wanted to bring your attention to, there are a couple bills in the Iowa legislature that I wanted to make you aware of. One bill has been introduced in the House, and that would require agencies to reduce their chloride usage for winter maintenance by 5% each year. And cities and counties would have to report on that. Each year, we would have to document our reduction. There's another bill that is winding its way through the House File 68. Has allowed, I've told you about the blue lights on our snowplows, The DOT did a pilot project probably 4 or 5 years ago. They were allowed to do that, to have the blue lights on the snowplows. this bill would allow other agencies, cities and counties, for example, to use those blue lights. And the research that the DOT did several years ago showed that they were very effective as a means of the public being able to see plows. So we would be in favor of that. I would like to try putting some blue lights on our snow plows as well. So I will keep you updated on some of those bills. Can I answer any questions? Thank you.
Thank you.
Thanks. Kim?
Well, I was just gonna say, there's a Jerry that acts like she wants to talk, so I don't know if she really didn't get a chance to speak earlier, or.
We have moved on from public
Okay,
comments.
well,
If she'd
I'll
like
just
to.
text her that then.
Thank you.
Thank you.
Any other department head or elected official updates?
Lord, this is Dr. Ibonie. I know that COVID is at the bottom of the agenda, but I have to attend also a business town hall meeting regarding COVID-19 vaccinations. So I would do my presentation now.
Yes,
to update
please.
you all. But first, before I begin, I just cannot start without thanking the community members that have shown the support to the health department. I thank you all tremendously, and do know that it takes all our collective efforts to fight this pandemic. Not only the pandemic, but also all our collective efforts to address the social and economic factors that impact us and contributes to our negative health outcomes. And so that's something that, it's important that we take into account. The health department, we will continue to do our very best to lead, but it's going to require all our collective efforts. And also, I applaud you all with the intentionality of understanding the impact of the disproportionate health rates in Black Hawk County. So when I look at the data in Black Hawk County, I want the community to also understand it's not just a matter of black and white. It's also a matter of all of us, because what impacts one will have an impact on the other. And that is something that we are seeing even within the healthcare system. Right now with the Affordable Care Act, the healthcare system, their responsibility is to ensure that people stay out of the hospitals. And that's very hard to do without an efficient and sustainable health department. So again, my heart goes out to you all. I don't consider this budget to just be Dr. Ibonie's budget or the health department's budget. This is the budget of the community, and that's the reality. That's why public is in front of our department. Public health, it's the public's budget. So do know that. And again, I thank you all, and we will do our very best regardless of the outcome. But going back to COVID, the Iowa Department of Public Health did release news yesterday about the B117 variant strain in Iowa. It is here, it is in Johnson County, and it is in Bremer County as well. And based on epidemiological data and modeling, researchers believe that the B117 strand can be spread more easily than the original strand of SARS-CoV-19. Again, this is based on epidemiological data. This is what we do. This is the heart of the department. This is what allows us to be able to affect the preventative measures that are necessary to protect ourselves from viruses such as COVID. And we do know that viruses mutate, but I'm hoping that as much as we'll continue to do our best to vaccinate the community so that we all are protected. So researchers believe the current COVID-19 vaccine will likely protect against the B117. Additional studies are ongoing. The State Hygienic Lab will continue to do surveillance by sequencing samples weekly. Need to continue to wear a mask or face covering, regardless of whether you have been vaccinated or not. Practice social distancing with those outside your household. Clean your hands frequently with soap and water. Stay home if you are sick, and get tested if you're exposed to or have symptoms of COVID-19. And consider getting a COVID-19 vaccine when available to you. We've received a lot of calls in regards to vaccine. I'm excited to see that people are wanting to get vaccinated. But again, it's an issue of supply and demand. And right now our supply is low. The state has communicated to us that hopefully by mid-February, our vaccine supply will start to increase. I hear all the frustrations also with the healthcare systems, having appointments. They're doing their very best. This is really because of the limited supply. So again, as I stated during our press conference, I'm asking you all to continue to be patient with us. We will ensure that everybody gets vaccinated, but we have limited supply. So it's really that's a bit out of our, it's not a bit, it is out of our control, but we are trying to do our very best. Our next our goal is to look at teachers in schools, K through 12, to see also how to get them vaccinated. The state has indicated when they allocate vaccines to us that we need to ensure to do a 50-50 allocation. So among individuals 65 and older, and also essential workforce. So we've gotten emails and communication from community members frustrated at that. But do know it's because we're getting, our direction is to allocate the vaccines 50-50. So let me give you a basic example. If I have 100 vaccines to go out into the community, 50 of those are going to go to the 65 and older, and the other 50 are going to go to the essential infrastructure. There are times where more might go to the 65 and older, depending on how fast the healthcare systems are able to get the vaccine administered. And there are times where it will just be 50-50. It will never be where we will allocate less to the 65 and older. But do know that is our what we've instructed to do, and we will follow those instructions. And again, for Blackhawk County as supervisors, as I stated over the past few years, it's not just a matter of COVID-19. We have so many different issues, and when you look at our data, chronic health conditions are really at the top. And the individuals that are greatly impacted by COVID-19 disease are those that are suffering from those chronic health conditions: obesity, heart disease, diabetes, asthma. Those are all the chronic health conditions that, are really, more likely, more susceptible to COVID disease. And so my approach has always been, let's get to the root cause of the problem. If you try to solve things from a very surface level, you'll continue to have the same issues. And I really don't think that our economy, our businesses, our schools are going to thrive if we also don't have healthy individuals. I mean, that is the truth. And so again, I ask everybody to continue to wear masks, continue to physically distance, continue to wash your hands frequently, and really, if you are sick, stay home, and protect yourself. And when you get a chance to get the vaccine, please do get the vaccine. There is light at the end of the tunnel, not there yet, so we have to continue to do these preventative measures. And if you have any questions, please do feel free to ask or email me. Readily available, and I appreciate you all forwarding also some of the emails that you're receiving from community members regarding COVID. That is our job, So please continue to forward any communication you receive in regards to COVID-19. Do so. That is our job. It is our responsibility to respond to our residents as well. So thank you.
Mr. White?
Nafisa, how can we move on to 65-year-olds when we don't even have the nursing homes done yet? And I've got a gentleman, I'm going to send you his email right after the meeting. Him and his wife are in their late 70s, have not been able to get a shot yet. This is outright wrong. And they both
So
got
please
many
do,
issues.
Supervisor White, please send me that information.
I will do.
The state did tell us last Friday that they are done. They're getting near complete for long-term care facilities. So do send me that information, because I would follow up with what facility this individual is at. That is not a problem at all, Supervisor White. Situations like this happen, so it's our responsibility to follow up and ensure that this person has been vaccinated or will get the vaccine.
Dr. Mbonye, now most people are getting contacted by their health providers, correct, in regard to the vaccine. What if by chance somebody doesn't have a regular and consistent health care provider? Who's going to be contacting those individuals?
Yes, that's a very great question, Supervisor Chaka. We did do a press conference to inform that if you do not have a primary care physician, please call the Blackhawk County Public Health. That is our job. This is what we do. I mean, we are gap filling services, so it's our responsibility to navigate those individuals. So they can call the health department, and we will ensure that to get them vaccinated.
Good, thank you. That's good information for us to get out, so
Yes.
Thank you. Any other department heads or elected officials that would like to provide an update? Agenda item number 6, a motion to approve the minutes.
So moved.
Second.
All those in favor say aye.
Aye.
Aye. Opposed? It is approved. The consent agenda.
So moved.
Second.
Mr. Veeder, roll call vote, please.
Little? Is he muted?
Yeah, he's there.
Little?
Yes.
Schwartz?
Yes.
White?
Yes.
Leyland?
Yes.
Trelka?
Yes. Item number 8A, a resolution that the minor plat of surveys submitted by Susan and Galen Eilers to minor plat 1.53 acres located at 7325 Marquise Road in order to construct one new single-family home. The property in question is located approximately 700 feet east of the West Marquis Road and Sylvan Drive intersection, and if approved, that the county auditor be directed to certify a copy of this resolution for the Blackhawk County
Second.
Recorder.
Galen, you need to put your hat back on. I didn't recognize you.
Seth?
Oh, okay. Yeah, I'll just be brief on this one. Planning and Zoning Commission at the regular meeting on January 20th, 21, reviewed and submitted the request by Susan and Galen Ayers to plat 1.53 acres, our agricultural residential district, in order to allow for the construction of one new single-family home at 7325 Marquis Road. The request was unanimously approved by the Planning and Zoning Commission. It was moved by Bozier and seconded by Schaefer to approve the request to plat 1.53 one new single-family home. The motion to approve carried unanimously, and for the rezone, there was a unanimous recommendation of approval on October 20th, 2020, and then it was unanimously approved November 17th, 2020 by the boards. It's the rezone from agricultural district to AR agricultural residential district.
Thanks, Seth.
Okay. Any questions for Seth? Mr. Veeder, roll call vote, please.
Schwartz?
Yes.
White?
Yes.
Leyland?
Yes.
Little?
Yes.
Trelka?
Yes. Item 8B, a motion to direct the county auditor to advertise for a public hearing to be held at 9:05 a.m. on Tuesday, February 16th, 2021, in boardroom 201 of the Blackhawk County Courthouse, 316 East 5th Street, Waterloo, Iowa, on the proposed ordinance number 77-248, from a request submitted by Matthew and Tina Gamunde to rezone 2 acres
So moved.
from A Agricultural District to AR Agricultural Residential District east of 8001 Winslow Road in order to construct 1 new single-family home. Any questions? Seth, you have any comment?
No comments.
All right. All those in favor say aye.
Aye.
Aye. Opposed? It is approved. 8C, a motion to send a letter of support for Hawkeye Community College to the U.S. Department of Labor's Youth Build Program.
So moved.
Second.
I did see somebody from Hawkeye on the phone earlier. Are you there, sir?
Yeah, there's 2 of us on here.
Yes, please. Your input, please.
Yeah, so this is Chris from Hawkeye Community College. Youth Build is a pre-apprenticeship construction program and advanced manufacturing program for 16 to 24-year-olds in the community that do not have high school diplomas. We're currently operating a standalone locally funded project called We Build Waterloo, downtown Waterloo on East 1st Street. And we would like a letter of support from Blackhawk County as we apply for federal investment up to $1.5 million to increase services for We Build Waterloo.
And we did receive an email on this. That is a matter of public record. Any other questions?
Are you going to work in correspondence with Central out there with their program that they have in place?
Actually, we are. We are going to fund the county's first dropout recovery specialist that is fully dedicated to reaching out to individuals that have dropped out from area high schools and reconnect them to the Waterloo Career Center. If they're eligible to return, if they're not eligible to return, they will be connected to Hawkeye Community College programming.
Thank you.
It's been moved and seconded. All those in favor?
I was just going to ask Chris if we're still in discussion.
Oh, go ahead. Yes.
Chris, there was a sentence in there regarding estimating the value of the in-kind staff support. And could you clarify that or give us a little more information on that, what you would like us to put in?
Yes, the federal government requires us in all of our letters of support to track in-kind services. And we worked out a verbiage that is, well, Linda, it's track any cost that is directly provided in cash or costs associated with anything related to the partnership or organizational structure or service delivery or any possible way that funds are expended in any in-kind process. So as a community college, we're investing cash and in-kind services up to about $700,000 for this project. The county, we're asking you, if you approve the letter of support, to include something in that in-kind area, but we are not asking for direct cash assistance.
Mr. Little, I saw you light up. Do you have a question? Any other questions? All those in favor say aye.
Aye.
Aye. Opposed? It is approved. Item 8D, a resolution that the lowest responsible bid received from KAM Line Markings, Gilbert, Iowa, for fiscal year 2021 pavement markings, project number L-7621, in various locations throughout the county with a bid of $69,887.66. Engineer's estimate was $96,218.97. Be awarded and for the chair to sign the contract, conditional to the receipt of the certificate of insurance as recommended by Catherine Nicholas, County Engineer.
How come this is so much lower this time, Kathy? Is it something cheaper? Seems like we're getting a better deal.
Yeah, I think we did get a good price from Camline, so we want to go ahead with Camline. We've used them before. We like their work. Mm-hmm. And it is quite a bit under what we estimated, and that could be maybe we thought we make our estimate in the fall, and then we have Camline go out and look at roads, or our bidders, excuse me. So I think maybe we've had a decrease in amount of markings that we need. I can check on that and get back to you, but We have used them before, and I would recommend that you.
So
take their bid.
they make up their mind which ones they're gonna mark.
Right, we give them, we tell them which roads we need remarked.
Okay.
But that, what we have told them and what we estimate in the fall could be a little bit different.
Okay,
Maybe
thank
that
you.
accounts
Thank
for
you.
it.
Okay, I'm looking for a motion and a second.
Move to approve.
Second.
Mr. Veeder, roll call vote, please.
White,
Yes.
Leyland,
Yes,
Little,
Yes.
Schwartz,
Yes.
Trelka.
Yes. Item 8E, a resolution that the lowest responsible bid received from Klusner Construction, Farley, Iowa, for fiscal year 2022 crack sealing, project number L-7722, various locations throughout the county with a bid of $36,095.76. Engineer's estimate was $30,748.24. Be awarded and for the chair to sign the contract conditional to the receipt of the certificate of insurance as recommended by Catherine Nicholas, County Engineer. Kathy?
yeah, so this, we did send out this proposal, we received 3 bids back. You can see that our budgeted amount was just a little over $30,000, and our lowest bidder was $36,000. So in this case, we are over budget by about $5,500, and we would propose to use some of that money that we would be saving on our pavement markings to pay for this work, the crack sealing work. And this work will not start until after July 1st.
Any other questions for Kathy?
motion to approve.
Second.
Mr. Veeder, roll call vote, please.
Leyland,
Yes,
Little,
Yes.
Schwartz,
Yes.
White,
Yes.
Trelka.
Yes. Item 8F, a motion that the personnel requisition for 2 temporary summer helper intern positions with no job offer to be extended until after the fiscal year 22 budget has approved as recommended by Catherine Nicholas, County Engineer.
Second.
Kathy?
Yeah, just due to our heavy workload, primarily with the large Grundy Road paving project, we would like to send a person, we will need a person out there full-time this summer to assist us. And we also would like to hire another person to help us with our sign inventory. So we're asking for 2 summer interns this summer. We have budgeted for those, assuming you approve the FY22 budget. So we would ask that we be allowed to hire 2 individuals this summer.
Okay. Thank you. It has been moved and seconded. All those in, any other questions for Kathy?
Nope.
All those in favor say aye.
Aye.
Aye. It is approved. Item 8G, a resolution that the lowest responsible bid received from Aspro Incorporated, Waterloo, Iowa, letting held January 20th, 2021 at 10 o'clock a.m. for project STBG-SWAP-C007 163-FG-07 for HMA resurfacing cold in-place recycling on Dunkerton Road, C66, from Highway 63 east 4 miles to Elk Run Road, V43, Iowa Department of Transportation Contract ID 07-C007-163, with a total bid of $1,526,182.19. Engineer's estimate was $1,953,922.54. Be awarded as recommended by Catherine Nicholas, County Engineer. Kathy?
So because we are using federal swap funds or state swap funds and money from our FM account, this was led through the Iowa DOT. They received 2 bids, one from Aspro and one from Matthey Construction from out of Wisconsin. I would recommend that you accept the low bid from Aspro. It is almost $400,000 under our engineer's estimate, and they've done many miles of work for us over the years and give us a good product. So I would recommend that you accept the bid from Aspro.
Move to approve.
second.
Any other questions for Kathy? Any other discussion?
I'd like to see these estimates a little bit closer. That's almost $500,000, 400 and some $1,000.
Yeah, sometimes it's hard to know what the cost of asphalt
Yeah, I
is going to
understand.
do, so we do like
That's
to
a
be
lot of money.
conservative.
Thank you.
Kathy.
Mr. Veeder, roll call vote, please.
Now, Mr. Chair, I wanted to ask a question about the previous motion. I wasn't certain as to Supervisor Little's vote. It sounded like you said nay, Tom. What was your vote on the personnel requisition motion?
I think it was nay.
I thought you said yes.
Well, James and I thought you said nay, so
I did too,
we're
yeah.
just uncertain.
Tom, can you hear us? What was your motion on the personnel requisition?
Approval.
Thank you.
And now the roll call for this action. Little,
Yes.
Schwartz,
Yes.
White,
Yes.
Leyland,
Yes.
Trelka.
Yes. Agenda item 8I, it's a resolution that the lowest responsible bid received from Blackhawk Service Company, Humboldt, Iowa.
You skipped one, Dan.
Oh, yes, okay, I jumped ahead here. All right, a resolution that the lowest responsible bid received from Aspro Incorporated. This is item 8H. A resolution that the lowest responsible bid received from Aspro Incorporated, Waterloo, Iowa, letting held January 26th, 2021, at 9:05 a.m. for project LFM-5015-7X-07, grade and pave on Brandon Road from 500 feet west of Blackhawk County Buchanan Road to Blackhawk County Buchanan Road, and project LFM-5020
No move.
-7X-07 on Canfield Road from north of Indian Creek Road to south of Young Road, with a total bid of $817,504.84, with the engineer's estimate of $925,892.90, be awarded as recommended by Catherine Nichols, County Engineer. Kathy, go ahead.
Yeah, if you recall, we did open this bid in the boardroom a week ago. We did just have the one bid from Aspro, which we were expecting, to be honest. It's a small amount of work in two separate locations in the county, and just due to the RAGBRAI coming through, we've had to put some scheduling requirements on the contractors, so we did just expect the one bid. And it is well under our engineer's estimate, so I would recommend that you would take the bid from Aspro.
Any questions for Kathy? Any other discussion? Mr. Veeder, roll call vote, please.
Schwartz,
Yes.
White,
Yes.
Leyland,
Yes.
Little,
Yes.
Trelka.
Yes. Item number 8I, a resolution that the lowest responsible bid received from Blacktop Services Company, Humboldt, Iowa, letting held January 26, 2021 at 9:07 a.m. for project L-7522, fiscal year 22 seal coating in various locations throughout the county, with a total bid of $119,767.18. The engineer's estimate was $139,409.28. Be awarded as recommended by Catherine Nicholas, County Engineer.
So moved.
Second.
Kathy?
Yeah, so this was the other bid we received last week in the boardroom. We did have 5 bidders, if you recall. And Blacktop Services has done work for us before. They do good quality work. They are under our estimate, our budget estimate of $139,000. So I would recommend that you do accept the bid from Blacktop Services and sign the contract with them.
Thank you. Any other questions, comments? Mr. Veeder, roll call vote, please.
White,
Yes.
Leyland,
Yes.
Little,
Yes.
Schwartz,
Yes.
Trelka.
Yes. Item number 8J, it is a resolution to rescind the 1/26/2021 resolution passed on a roll call vote following motion to eliminate the epidemiologist position and/or the funding for that position, and to approve reduction of the Health Department's proposed 5.24% fiscal year 2022 budget increase to a 2.22% fiscal year 2022 budget increase, reducing the health department's fiscal year 2022 proposed budget amount by $98,699.
Mike, is that something you want to address? Or
I can explain this, sure. So last week there was a resolution that was made on motion, and it said that it was to eliminate a position and or the funding for that position. That language wasn't entirely clear. I believe, based on several times watching the board meeting, and unfortunately I couldn't be there for that one, that the intent was to reduce the funding, reduce the health department's funding from their budget by the salary and benefits for that position. However, it wasn't entirely clear, and different people drew different conclusions from that proceeding. As a result, this resolution is a combined resolution to rescind the resolution that took place a week ago and replace it with one which I think was intended to simply reduce the funding from the health department's proposed budget by $98,699. It's essentially a corrective resolution.
Is there a motion?
So while you're saying we could rescind it for the reason of the epidemiologist position, it would still be approving the $98,699 in one resolution.
Correct.
Okay.
Basically a two-part resolution.
Yes.
Two rolled into one with one vote.
Do we have a motion?
So moved.
Second.
Any other discussion, comment?
I would just like to thank all the community members that spoke earlier in the meeting today. I thank everyone for keeping it respectful as well. I just want to say that overall the county's budget is in strong, healthy position, and that now is just not the time, I believe, to put an unnecessary squeeze on the Department of Public Health as they get us through this pandemic, as well as they undergo the very important federal accreditation process that places on the core mission of public health, which is disease prevention and the promotion of the health of the community, as a top priority. As they get through this accreditation, it's going to be critical that the positions like the second epidemiologist be there so that we're eligible for future federal support and federal funding. And so I think that while it might look like a savings right now, and I know that this resolution is just changed to be just about the dollar amount, that dollar amount is still exactly tied to what the salary and benefits of this second epidemiologist position is. And so I just think it's the wrong time, and it's unnecessary to put the squeeze on a department and on staff that have been going above and beyond for the last 8 or 9 months here.
Linda?
I guess my feelings on this are, I think it's a sad commentary, I guess, that we've come to this point where we re-examining a health department's budget, and granted it's a $5.6 million budget and part of our $65 to $70 million budget ultimately. But January 14th, I think I looked back at the date, was when the health department presented their budget, and we asked, some of their supervisors, or maybe it was all of us, asked that they take another look to make some possible reductions. And we were told then it was as lean as it could be. And I don't think we as supervisors were out of line to ask any of our departments, I know we've done it with other departments as well, especially our larger ones, that to ask them to go back and take a look at their budget and see what could be cut from those items. And I think, as all of you know, last week I was looking at some things, even like we talked about the carpeting and furniture and those types of things that could be pushed off. So yes, were there items in there that I think could be cut? I certainly did. But I guess what concerns me most is that since that 14th meeting, it seems we've all kind of dug our heels in, and no one has really addressed, like, if there was information we needed, or we needed to understand the positions or the line items or whatever that was, that we didn't have that discussion before today, that why all this time's gone by and we just keep going back and forth with the same arguments. So to me, that's very disappointing. There isn't anything I agree more than we talked about having this joint meeting. I'm not sure we'll make progress on that. If there's anything, I guess, that I think is important to us, it's working together and that communication is needed. That doesn't mean we'll agree, but we can work together, hopefully civilly and respectfully, and walk away from having responses to all of us, I guess, and better communication. Like I said, I don't know if those meetings will come about, but it just seems that there's an unwillingness to give on both sides here, and it was very disappointing. I can't support this right now as it's written, but like I said, nothing that I've ever thought that we've done in the last few weeks, from my perspective, has ever been a decision that if we were making cuts or reductions, didn't mean we didn't support the health department.
Oh.
That's the efforts, they've been tremendous. I appreciate everything they've been doing, but that our job is looking at the budget and taking a closer look and scrutinizing, and sometimes we think that's needed. Maybe you don't, but then it's your job to convince us that you've done the best job you can. And just like I said, I think it was probably, maybe there's a lot of disrespect on both sides, so that's been very disappointing to me. But that's, I guess, my comments for the most part. Yeah, thank you.
Well, I think the dialogue is going to be important. We'll have our meeting in March, our joint meeting. As a matter of fact, I'm meeting with Pastor Mary tomorrow. We're going to have a lunch meeting just so we can continue the dialogue and move forward. Craig, Tom, comment, question? Mr. Veeder, roll call vote, please.
White,
Yes.
Leyland,
No.
Little,
Yes.
Schwartz,
No.
Felka.
Yes. Item 8K, discussion on county preparedness and possible updates for COVID-19. Dr. Ngbonye, are you still with us? Do you have anything else to provide?
She had a meeting at 10.
She's there.
Oh, she's back.
Yeah, I'm still with you all. No, I don't in regards to COVID, but I will talk about preparedness and kind of tie it to some of the statements I've heard. I do feel that I've been presenting to the Board of Supervisors all the information I present to the Board of Health in regards to the restructuring and rebuilding the agencies to fill in the gaps necessary for us to be efficient and sustainable. So I do encourage the board's meeting because I don't know where the misunderstanding is, but I have to speak on my own behalf that I do present. Actually, that's why my presentations during the budget are so lengthy, and we've had also a work session that I think it's maybe time for the boards to meet so that there's clarity on why I was recruited, what I acquired, what are the gaps that needed to be filled, and where do we need to go in the next 5 or 10 years as a health department. So I just encourage that, because I think that the county preparedness is really tied into these discussions. So I thank you all for that.
Thank you.
Just to say a couple of things on COVID. I know that COVID fatigue is very real. It's hard to keep up these mitigation efforts. But the light is at the end of the tunnel with the vaccines, as long as we don't mess it up and exacerbate the community spread, which can allow for more genetic variants to come. And so I know, the Super Bowl is coming up and all these things, and if people are getting together, just, of course, the recommendation is that you don't get together. But if you are going to get together, think about ways that you increase fresh air in your home. the handful of, you know, I mean, you do things like even superheating your home before you have guests, and then you can crack the window open and that kind of stuff, and still wearing masks and keeping your distance while you try and enjoy, because we miss our friends, we miss our families so much, and it's so hard. But you know, there's a permanent way of missing them that we don't want to see, and that is more unnecessary death in this community. And so I just encourage people to just hold on to the hope that the vaccines are coming. A third vaccine is just about to become available as well. Everybody is saying that the supply is supposed to increase in the next 2 weeks in the middle of this month, and so just encourage the residents of Blackhawk County to stay strong these final months, so that we can all make it to the finish line together.
Thank you. Mr. Schwartz, any other input?
Mr. Chair, I'd just like to make a couple comments about the whole thing. This deal with not only the health department, but the pressure it's putting on everybody in the world, especially in Iowa or in Blackhawk County, with our mental health. There's a lot of things going on. There's a lot of things that could be done that we need to sit down at the table, like Ms. Whalen made a comment. Somehow it wasn't construed to the health department what we asked for, you know, for the budgets. All the other departments turned their budgets in the way we wanted. That's not a slap in the hand. I did my homework. I take pride in the work I do. I put a lot of hours in. I studied this stuff. I heard someone say through all this stuff, the different thing, a good point you made, Chris, wearing your mask. There's people out there today that aren't wearing their mask. I was in the grocery store yesterday, and they'll sit there and they'll stare you down, hoping that you'll say something to start a confrontation. And it's not right. We shouldn't have to be putting up with that stuff. It's just a bad time in the world, and especially in our county, for just overall mental health. People need to take a deep breath and try to work together. I wrote a letter several months ago about it. We need to get along with one another. Just because somebody makes a decision doesn't mean they have a less respect for anybody anywhere. I take that as a slap in the face sometimes when some of those comments are made that we don't, you know, that, oh, you voted that way because of something else. No, I voted that way because I did my homework.
Yeah. Well,
and I think in the end, we are going to make it through that. But like Chris said too, a lot of people have died needlessly. But my feelings are the epidemiologist isn't going to solve a thing. That has nothing, and I realize they'll be able to hire one anyway. That's just my feelings towards it. I'll never change my attitude towards that. And I've even had doctors tell me I did the right thing, so I felt pretty good about that. And I will never give the doctors' names out because I'm not a name dropper.
All right.
Last night, I was thinking more about this and our decisions today, obviously, and thought, you know, where we were last year at this time.
Right.
We approved the budget, and then March hit, and everything went upside down.
Yeah.
From what we had to handle as a courthouse and the buildings and the parks, and the staff's done a tremendous job, you know, of getting us through all that. We've got all kinds of precautions in place. We've been, I think, fairly good as a county at all the things we've done, but I just thought things changed quickly, and here we are planning. We don't know what may happen the rest of this year yet, between now and June 30th, let alone we're trying to plan for fiscal year 22. And that's still a ways out there, so there might be a lot ahead of us yet to do.
Be here before we know it.
Yeah.
The way time flies.
Okay, item number 9. Any reports or information from the board? I believe today is the first day of jury trials, so if citizens come to the courthouse for services and there's some delays coming in, we ask that you just be patient with our personnel because there could be lines. I'm not sure if there are, but there certainly could be. So just be patient with the process.
I would just like to say, today marks the second day of Black History Month, and we of course have a really rich history and of contributions from Black Americans here in Blackhawk County, and so that I just challenge myself and everyone else at the county to spend this month reflecting on ways that we uplift the positions and conditions that many of our Black residents do live in here in this county. The Wall Street 7 report was referenced a couple times today, and that is going to be a community-wide effort involving all levels of government to address that and to get to a more equitable and more just community here in Blackhawk County.
Thank you, Mr. Schwartz. Mr. White? Ms. Leyland? Mr. Little?
Nope.
Motion, motion to adjourn?
So moved.
All those in favor say aye. Aye. Opposed? We are adjourned.